What is high blood pressure or hypertension? How do you prevent it? What are the symptoms of high blood pressure? And how is it treated? Did you know? An estimated 1,280,000,000 adults aged 30 to 79 years worldwide have hypertension, most living in low- and middle-income countries. An estimated 46% of adults with hypertension are unaware that they have the condition. Less than half of adults with hypertension are diagnosed and treated. Approximately 1 in 5 adults with hypertension have it under control. Hypertension is a major cause of premature death worldwide. Hypertension or high blood pressure is when the pressure in your blood vessels is too high. When it's higher than 140/90, it is common but can be serious if not treated. People with high blood pressure may not feel symptoms. The only way to know is to get your blood pressure checked. If you have high blood pressure, the force of the blood pushing against the artery walls is consistently too high. The heart has to work harder to pump blood. If you have a blood pressure of 140/90 as this is considered high blood pressure, you should discuss this with your doctor. The first thing that is usually recommended for people with high blood pressure to do is lifestyle changes. High blood pressure, also known as hypertension, has many risk factors, including 1. Lifestyle, unhealthy diet, physical inactivity, smoking, and excessive alcohol consumption. 2. Weight, being overweight or obese, especially around the midsection. 3. Family history, having a family history of hypertension. Genes that impact blood pressure regulation can be passed down from parents to children. 4. Age, being over 65 years old. When we grow older, we are at risk of developing high blood pressure. 5. Other medical conditions, having diabetes, kidney disease, or other conditions that can cause high blood pressure. 6. Hormonal factors, pregnancy, menopause, and using birth control pills can increase the risk of high blood pressure in females. 7. Environmental factors, air pollution can increase the risk of hypertension. 8. Medications, some prescription drugs such as cough and cold medicines, some pain relievers and birth control pills can increase the risk of high blood pressure. 9. Illegal drugs, cocaine and amphetamines can increase the risk of high blood pressure. How can you know if you have high blood pressure or not? To prevent health complications. Symptoms. Most people with high blood pressure have no symptoms, even if blood pressure readings reach dangerously high levels. You can have high blood pressure for years without any symptoms. A few people with high blood pressure may have symptoms. However, these symptoms aren't specific. They usually don't occur until high blood pressure has reached a severe or life-threatening stage. Checking your blood pressure is the best way to know if you have high blood pressure. People with very high blood pressure, usually 180/120 or higher, can experience symptoms including severe headaches, chest pain, dizziness, difficulty breathing, nausea, vomiting, blurred vision or other vision changes, anxiety, confusion, buzzing in the ears, nosebleeds, abnormal heart rhythm. If you are experiencing any of these symptoms and a high blood pressure, seek care immediately. The only way to detect high blood pressure or hypertension is to have a health professional measure your blood pressure. Having blood pressure measured is quick and painless. If high blood pressure or hypertension isn't treated, it can cause other health conditions like kidney disease, heart disease, and stroke. How to prevent getting high blood pressure or hypertension. Lifestyle changes can help lower high blood pressure and can help anyone with hypertension or high blood pressure to control it in order to prevent complications. Many who make these changes will still need to take medicine. These lifestyle changes can help prevent and lower high blood pressure. Lifestyle changes include eating a healthy diet. Eat more fruits and vegetables, and less processed foods, fats and sugars. Choose lean meats, fish and low-fat dairy products. Reduce your salt intake by reading food labels and choosing low-sodium or sodium-free foods. Be physically active. Aim for at least 150 minutes of moderate intensity aerobic activity or 75 minutes of vigorous aerobic activity per week. You can also do strength building exercises at least 2 days a week according to your health condition. Maintain a healthy weight. Losing even a small amount of weight can help reduce the strain on your heart. Limit alcohol. Men should have no more than 2 drinks per day, and women should have no more than 1 drink. A drink is considered to be about 1 ounce of alcohol, or about 1 beer, 1 glass of wine, or 1 cocktail. Get enough sleep. Aim to get 7 to 9 hours of sleep every night. Don't smoke. Smoking can injure blood vessel walls and speed up the hardening of the arteries. Other factors that can lead to high blood pressure include stress, certain chronic conditions such as kidney disease, diabetes, and sleep apnea. Take medicines as prescribed by your healthcare professional or doctor. Keep appointments with your healthcare professional or doctor. Don't eat too much salty food. Try to stay under 2 grams per day. Don't eat foods high in saturated or trans fat. Don't miss or share medication. Reduce the risks of hypertension by reducing and managing stress. Regularly checking your blood pressure. Treating high blood pressure. And managing other medical conditions. Reducing hypertension prevents heart attack, stroke, and kidney damage, as well as other health problems. Treatment for high blood pressure or hypertension. Stage 1 hypertension can be treated with lifestyle changes and medications. Self-care includes lifestyle changes can help lower high blood pressure and can help anyone with hypertension. Many who make these changes will still need to take medicine. These lifestyle changes can help prevent and lower high blood pressure. Lifestyle changes include diet. Eat a heart-healthy diet with less salt, more fruits and vegetables, whole grains, and low-fat dairy. Exercise. Get at least 90 to 150 minutes of exercise per week, including aerobic activity and strength training. Weight. Maintain a healthy weight, or lose weight if you're overweight. Alcohol. Limit alcohol to 1 drink per day for women and 2 drinks per day for men. Smoking. Stop smoking. Sleep. Get 7 to 9 hours of sleep daily. Stress. Manage stress. Blood pressure. Monitor your blood pressure at home to detect high blood pressure readings. The treatment approach for stage 1 hypertension or high blood pressure depends on the severity of the condition and the risk of developing other diseases. If lifestyle changes don't reduce blood pressure to goal after 6 months, medicine treatment may be recommended. If you have high blood pressure, your doctor may recommend 1 or more medicines. For most people, the goal is to have a blood pressure less than 140/90. Complications of uncontrolled hypertension. Among other complications, hypertension can cause serious damage to the heart. Excessive pressure can harden arteries, decreasing the flow of blood and oxygen to the heart. This elevated pressure and reduced blood flow can cause chest pain, also called angina, heart attack, which occurs when the blood supply to the heart is blocked and heart muscle cells die from lack of oxygen. The longer the blood flow is blocked, the greater the damage to the heart. Heart failure, which occurs when the heart cannot pump enough blood and oxygen to other vital body organs. Irregular heartbeat, which can lead to a sudden death. Vision loss, damaged blood vessels in the eyes. Aneurysm, a weakened and bulging blood vessel that can be life-threatening if it ruptures. Cognitive impairment, Hypertension may increase the risk of Alzheimer's disease, dementia, and vascular dementia. Sexual impairment. Hypertension can affect blood flow, which can lead to erectile dysfunction. Hypertension can also burst or block arteries that supply blood and oxygen to the brain, causing a stroke. In addition, hypertension can cause kidney damage, leading to kidney failure.